Hello, everyone. The COVID-19 pandemic have really ravaged our world from when it was first discovered in one part of the continent and then it began to affect the other part of the world. People have died. A lot of people have been in the hospital, and right now there are tons of data being collected by the World Health Organization about the number of persons that have been hospitalized, the number of persons around the world that have been vaccinated, those who are fully vaccinated, those who are not fully vaccinated, and so on and so forth. So it is good to know that we've had access to this data, and it was a pleasure to work on cleaning and getting this data sorted out to get to the point where we can I can actually create this amazing visualization I am going to share with you. And the first thing I want to share with you is the page one report. As you can see from my dashboard, all I need to do is to click the page one report and it will take me to page number one. So this is my WHO COVID-19 report and analysis being visualized. I was able to look at the age of people from 65 and older and the age of 70 older. I looked at the cardio that's had death rate by continent. This would all actually enable the data analyst or the World Health Organization to really get to study and know more about what exactly are the causes of death, when it comes to COVID. And you can see in Europe, for instance, we had more than 3 million persons who are aged 70 years and older. And you can see that the death rate in Europe was actually really, really high, because these persons who were a bit older um, got affected by the COVID, and the death rate was really high. Asia, followed by the top here is Europe, followed by Asia, which is roughly 8 million persons died of of the cardiac death rate. And then you have North America, you have Africa, you have South America, you have Oceania, and then of course you have Asia here. So I was also able to look at the hand washing facilities, the hospital beds per thousand, and human development index by life expectancy across continents, of course. So if you look at the report here, you can see that hand washing facilities were roughly 2,913.33, and human development index was just 342. The graph shows exactly that across board. And we also looked at first weekly hospital admissions per million by continent and population density. You could see here that Africa records a rough 54 uh, weekly visits of people in the hospital per million, that 54 million across the continent. Europe had 49, Asia had 48, America had 45, Oceania had 17, North America had 32. And then we have the total count of tests in during COVID was 137,000. We had a total number of new deaths, um, 22 million. A total number of deaths was 6 billion. That's a massive, a really, really, really worrisome number. And of course, we had new cases of 1 billion. If we look at the map here, which I was able to import through the other visualization sections in Power BI, you could see that I was able to look at the total number of ICU patients by continent. And if I'm to show, this is, let's see, this is Asia. And let's see, Asia has total number of ICU patients in Asia was 31.42,000. in Africa was 34,000. In South America, and you can see that the bar chart there is really low. Let's just see the number. South America was 7,000, and in North America we had 17,000, and then finally in Asia, in Australia, we had 6,000. So that's just how amazing power BI is in terms of helping me get this visualization sorted. So we go to the next page to see page 2. This is another visualization, and we can see was able to look at the key influencers here by sections, and the new deaths goes up to 858,000. That's 42,000 roughly per million. You could see the differences there, and this is how to analyze the key performance index in a visualization like this. So we had new deaths per millions, average of new cases, minutes of new cases per million, maximum of new cases per millions. This is brilliant. This was just presented. And we could see the second segment, and new deaths is less than or equal to 632. This this is how amazing this visualization is when it comes to creating insights and helping us to see the trend of things. This is the total new cases per million and new deaths per million, and we have if we have um, total number of fully vaccinated people and total vaccinations of people, almost half the number of the population, a 50-50 percentage. We have life expectancy by male smokers, female smokers, and extreme poverty. This would, of course, help us to know what exactly is happening in our world in terms of why people are dying um, even after getting vaccinated. We want to know exact cause of World Health Organization has really gone in depth into creating these insights for us to look at over a period of time. Okay, so and it's cost across the countries. And we have a continent here. The total number of new cases roughly 1 billion. New deaths recorded 189,000. 189 across continents. New test was there. We had the population density of people of 50 billion persons, and we had 50 million total cases, roughly 288,000, and we had total number of deaths. So this is roughly 50 billion. And then we go to the next, the last point of our report, where we could see the total cases per million, deaths per total deaths, and first total vaccinations by continent. We also see the continent by count of hand washing. And we discovered that Africa seems to have almost the lowest when it comes to percentile. You can see here, Asia is 69%. We could see North America is 83%. We could see South America, it's 90%. And we could see Oceania is 98%. So Africa has a whole lot to do when it comes to building hand washing facilities as against the rest of the world. So that's the report, really, and it's been an amazing journey with quantum analytics. With my team members and my team leads, everyone have been amazing, and I'm so happy to get to this point in my data analytics journey. And I look forward to the different opportunities to be a part of any group, any organization, any company that will wish to take me in and to share data and allow me to visualize and clean this data. Thank you so much for listening. Please share your comments, feedback with me. Thank you.